Okay, good afternoon or good evening, ladies and gentlemen. My name is Alexey Laureshin. I am chief and editor-in-chief of the Traffic Safety Research Journal. I'm going to be the host and moderator of today's webinar. Just a little technical note before we start. So as you see, it's just one big Zoom meeting. So technically anyone can start talking at any time. I would really encourage you not to do so. So please mute your microphones. After the presentation, there would be opportunity to ask questions, but again, to get some order, I will ask you to write your name in the chat. Don't write the question, just write the name, and I will call you out, and then you can just start speaking and ask what you want. Yeah, that was the technical part. And then to introduce today's topic and today's speaker. So at Traffic Safety Research, we do receive quite many submissions from authors coming from low and middle income countries. And unfortunately, quite many of those get rejected. And it's not because of some kind of arrogance or elitism or prejudice from our side. Quite often I know the authors personally, and I know that they really care about traffic safety. They care about saving lives in traffic, but somehow some little part is missing that doesn't make those papers truly interesting for a bigger audience, because as a journal we really want to reach a large community of researchers and practitioners. So that was basically my motivation in choosing and inviting today's speaker, Geetam Tiwari, who is really expert on doing research in low and middle income countries context. So Geetam, she has been based at Indian Institute of Technology, Delhi in India, starting from 1990s somewhere. She has had different positions there, including being a director for some years of Transport Research and Injury Prevention Center. Also, what is really relevant here, she knows the publishing business from the inside. She has been the editor of the International Journal of Injury Control and Safety Promotion for the last, 15, 16 years, quite a while. So you know how it feels when you get those papers and you feel like, it's a good effort, but it's not good enough. Geetam, without much ado, I give the floor to you, and you're most welcome.
Thank you so much. First of all, I really want to thank Alexa you for inviting me for this. And I remember first time when you sent me the message, and I went to the website and I checked all the earlier videos, all the earlier experts who had done this lecture, and I was so encouraged, and I found them really fascinating and very useful. So that's why I got excited and I went and told everybody in my office, you have to watch these videos. And so I'm really pleased to be in that company now. And I find it, and so first of all, I want to say, thank all the participants who have joined today. And I look forward to your questions. And I hope what I have to share today is useful for many people. So let me share my screen and we will start from there. All right. So in this present talk, I am going to actually just highlight what are traffic safety research priorities in low and middle income countries. what could be the relevant research questions, some very serious issues about data that the researchers must understand. And really, for publication, I will share some thoughts about, how we have to kind of look for not good research questions and data, also, what is the theoretical understanding and how it guides our research design itself. So, fundamentally, I will cover these main three topics in this talk. I will look at, probably most of you are aware of the current status, but still, for completeness sake, I will look at some data from Global Road Safety Report published by WHO in 2023. Try to understand what the victim patterns are in low and middle income countries versus high income countries. And then I would like to share results of this evidence gap map, which we published in collaboration with Campbell. And we looked at all research studies for past 20 years. So I will share with you what kind of results we got. And actually, that evidence gap map was a very good starting point for us also to understand where the major gaps in research are as far as low and middle income countries are concerned, and what could be some issues from transferability of results from good studies that we find from high income countries. And then, as way forward, we will look at the issues, data sources, but how we can solve some of these issues. And that is what the new researchers should be looking at, and how safe systems approach and Vision Zero principles can guide our research questions. And that's really important because that understanding kind of provides a guidance on how to ask relevant research questions. And then a little bit, few examples from some robust study designs, which is what really makes your research results more acceptable by the research community and therefore becomes more publishable. So, this data, I'm sure most of you are aware of it. When this WHO report was published in 2023, it shows what is the estimated number of traffic deaths globally. And there was kind of some little bit of rejoicing here, because if you see, when we trace the trend from 2011 to 2020, we find that there is a slight decrease for the first time in history. The total numbers seem to dip from 1.25 million to 1.9 million. So perhaps this is the impact of decade of action, which was declared by WHO, and lot of activities were undertaking in many countries. But when you start looking at some details here, actually the data also, this report also gave what are the victim shares in different regions of the world. And if the two regions that I've highlighted here with arrows, African region and Southeast Asia region, this is where majority of the low and middle income countries are. And what I have tried to highlight here is that on the side panel, you see globally we have 30% victims of four-wheelers, about 23% of pedestrians, and 21% of motorized two-wheelers. But when we look at these two regions, Africa and Southeast Asia, this is where majority of the low and middle income countries are, we find that the share is kind of slightly different in the sense that share of power two-wheeler becomes really high in Southeast Asia. You can see here it is 48%. And whereas share of victims of car occupants, four-wheeler occupants is much less as compared to the global numbers and of course other parts of the world. And pedestrian share remains high. So in fact, if we add the three vulnerable road users, powered two-wheelers, pedestrians and bicyclists, that is almost about 65 to 70%. And this pattern is little different from other parts of the world. So the summary that this report provides, that of course from 2010, if we compare the total road traffic fatalities decreased from 1.25 million to 1.19 in 2021. But among the 34 IRTAT countries, and you know IRTAT country is mostly the high income countries, OECD, all of EU, but apart from that, Japan, Korea, these are also high income countries, and North America, Canada, etc. So out of 34, 29 recorded decrease in road traffic fatalities. So these are all our high income countries, where the historical trend has shown us already from 1970s, most of these countries have witnessed downward trend. And in this decade of action also, this is where we recorded majority of the reduction. Denmark, Germany, Japan, Korea, Lithuania, etc. These recorded lowest ever numbers of road traffic fatalities. And why I'm highlighting here, because these are already the successful countries earlier also. The number of road traffic fatalities increased, in fact, slightly in Israel, Chile, Colombia, Slovenia, and of course, USA is outlier amongst high income countries. And for all road user type globally, except powered two wheelers. This becomes a very major concern for us now in low income countries. Now, this is coming from IRTAD report. And one thing that I wanted to highlight here, if you look at largest drop in fatalities amongst pedestrians, uh, and in fact, all others have also reduced. Car occupants have reduced, cyclists have reduced, but even in EU, is that country? This report, this graph is from EU report. There also, powered two wheeler is increasing. Though here we see only a small increase, but one thing we have to keep in mind, that in any case, use of powered two wheeler in these countries is happening in Asia and countries also. So what is really giving a major difference. Now, as far as data is concerned, then here again we start seeing some very important issues here. And in this table, I am showing you road traffic fatality data in East Asia region. Low and middle income countries of Asia are. And if you just, so there are two numbers shown here for all these 11 countries which are part of Southeast Asian region, SEER region. So here the two numbers, of course, first we have total number of deaths reported. Then we have reported road traffic deaths per 100,000 population for 2021. And this is compared with the data of 2010. And then the rates are shown. So now you see most of them where the red ones are where the numbers have increased substantially. So I am looking at the third last column, which is percentage change in reported road deaths in the period 2010 to 21. And you see Bangladesh increases by 57.9%. Nepal is increased by 71%. Myanmar is increased by 94%. And estimated rate also, you can see all of them seem to have increased, which is shown in red color. So just in Southeast, even though globally we have seen the reduction, But in these countries of Southeast Asia region, we find there is increase in the same period. And increase is substantial. Then the other thing that we start looking at here is so WHO is publishing the reported numbers. These are reported numbers by the country, what the country governments are giving. Then Institute of Health Matrix, which also does global burden of disease estimates, they IHME also is publishing numbers for uh, total number of deaths in road traffic fatalities, and then also breakup of who are the victims. So this is what we are comparing here. Uh, Pedestrian numbers reported in black, that is comes from WHO report, and in red color is the IHME estimates. So now you see some reported numbers are missing here, but if you look at just India data, so Government of India report, which is published by Ministry of Roads and Highways, says 20% deaths in road traffic victims are pedestrians, whereas IHME estimates is 35%. And overall, if you see, the pedestrian is very, very high, ranging from, I think, lowest here is 19% in this small island nation, Maldives. But all other places you see, it's above 30%. Thailand is reporting only 16%. Now, similarly, if you see bicyclists also, there are estimates here, major gap between IHME and uh, uh, reported numbers. If we look at uh, deaths of powered two-wheeler users, and again, you see the numbers are very, very high. So what is important to understand that, of course, data is important for our research work, but we also have to be aware that the quality of data that we are getting. And one way of understanding the quality is look at other sources also. What the other sources are saying, and of course, we can go into more detail of how IHME estimates are done and how believable they are. But clearly, there is a huge gap between uh, estimates which are done by more experts, looking at many different sources except only police reports, as compared to what is reported by the countries. Similar data I am showing also from African region. This is sub-Saharan Africa. And here also we are finding, discrepancy in data. So again, here we are also in red color, we are showing the ratio of what the WHO estimates are. Actually, WHO does use IHME estimates only now, and with comparing it with the reported data of the country. So again, you see, South Africa is pretty good. There is hardly any difference. But now, if we start looking at other countries like Lesotho, Angola, Uganda, Chad, Ghana, and it keeps on increasing in that order. Nigeria 7.9. The difference is 7.9 times. So all red color you see, except the first 2-3 countries. Everywhere the difference between the reported data and the WHO or IHME estimates is very, very high. And then you go to many other countries like, South Sudan, Burundi, Congo, etc. Very high difference. So again, we come back to this issue that research, it's really important to understand what data we are using. And of course, later I'll show some example. What are some methods of correcting this? So if we, for sub-Saharan Africa also, we summarize only 34% countries have provided data on road user type. Only 5 out of 39 countries have ratio which is less than 2. That's the table I showed you. For estimated and reported fatality rates, estimated fatality rates are very, very high, 21 to 36, whereas global average would be much less. 80% countries have estimated reported ratio greater than 2. Only Namibia, South Africa, Botswana seem to have reasonable data. No estimated rate is less than 20 fatalities per 100,000 population. And world average, global average is something like, if I remember correctly, 12 or 13 deaths per 100,000 population. And as far as road user fatalities are concerned, motorcyclists or powered two-wheeler users are always more than 20%, and especially in these countries, Kenya, Uganda, Cote d'Ivoire, Mali, and Benin. Pedestrians are more than 30%, Ethiopia, Congo, Kenya, Uganda, list of these countries. So from both regions, we are understanding discrepancy in data and how we have understood the discrepancy in data. And in both cases, the victim, the VRU share, and especially powered two-wheeler users, seem to have the highest risk in road traffic fatalities. So actually, data does matter a lot. And I will just share with you a very small example. So in India, we did this study for our ministry, estimating socioeconomic cost of road traffic injuries. This was done in 2018 for the government. And so here we estimated unit cost for fatality, cost for fatality, grievous injury, minor injury, and also crashes which involve no injuries. So this was a very detailed method. I will not get into this using human capital approach. And then we try to come up with a total national number. So what is the total cost of road traffic injuries in India? And we found that uh, so initially when the one number is missing, we just use the published government data, and the total works out to be 0.7% of our GDP. But then, as you can see here, we corrected it. So first we corrected it using these ratios, that for every fatal crash, grievous or injured person should be 15 times more, minor injury 128 times, and no injury crashes 200 times. And how these estimates were used? We looked at other studies from similar countries, and we found that this is the more believable ratio as compared to the published data, which shows that uh, non fatal crashes are only 3 to 4 times more than fatal crashes. So, using that, the first scenario is the cost estimates. And here, point when we were using the original 0.7%. After that, we also then corrected it using the GBD numbers or IHME numbers, because in the first scenario, we took the fatal crashes same as reported by government. In the second one, we changed that and we used the numbers which are estimated by GBD, and then we come out that the total becomes almost 4.5% of GDP, of our GDP. So just to emphasize the importance that for researchers, it's really important to understand the quality of data. And it matters a lot because, 3% versus less than 1% of your GDP is a huge difference. So when we are making a case to the policymakers how important this is, it's important to use the correct data. Now let's look at what are the emerging risks. I already flagged that powered two-wheeler users and pedestrians seem to be the major victims in all both major regions, African region and Southeast Asia region. And I'm showing here the numbers from India that this is a major challenge in India also. And the two graphs here are showing the percentage of households owning a motorized two-wheeler, powered two-wheeler, versus percentage of households that own a car. So you see the difference, and of course in urban and rural area. And the graph is also showing how it is increasing. So you can see that the first graph that is talking about powered two-wheeler. 60% of the households in urban areas in India own powered two-wheeler. So the use of powered two-wheeler is very high in our cities. And of course, that is one of the reasons also that we see a lot of them showing up in our traffic crashes also. Rural area, it is less than urban area, about 37%, but you can see it's an exponential rise. So that is posing a huge challenge, and I will discuss that a little bit more later also. As far as cars are concerned, four-wheelers, uh, only 16% households own cars. So our motorization is because of powered two-wheelers. And as safety researchers, we know that powered two-wheeler risk is very high. But as researchers now, it is also becomes important for us to understand that how our research questions and focus has to be around two-wheelers. And more detailed data shows that, of course, two-wheeler riders, users are at a very high risk, but also two-wheelers are imposing also a high risk to pedestrians. In Indian data, we find that about 30% of pedestrian deaths in pedestrian deaths impacting vehicle is two-wheeler. So this is an important aspect to understand. And in South Sub-Saharan Africa and many other countries, the use of two-wheeler is increasing, and therefore our research, we really have to work hard in understanding how to reduce risk to two-wheelers, powered two-wheeler users. Now, other emerging risk situation in many of these our countries is what is shown in this picture. So this is again example from India. This is a national highway. It's a high-speed six-lane divided road. This is connecting major two different running through many states, and it is designed for 100 kilometers per hour. And then you see in the first picture that how a large number of pedestrians are waiting at the median. They have jumped over a high median and they are waiting to cross this high speed traffic. And obviously in these kind of sections, we find that the pedestrian deaths are extremely high. And then you see in the second picture also, this is an expressway. So it is an access controlled expressway. Here the design speed is 120 kilometers per hour. And you see that this is a light commercial vehicle and how people are traveling. And this vehicle is not going very fast, but it is still exposed to very high speed traffic. So how do we reduce risk? Because yes, in theory, these are access controlled, but our land use patterns and socioeconomic reality is such that it is not possible to keep it completely access controlled. So in future, I mean, this is where a lot of deaths are coming, serious injuries and deaths. And we really have to see that what kind of research is required. What are the relevant research questions here to solve this problem? And many of our countries in policy level, we are talking about Vision Zero. All Southeast Asia region, so we don't have any standards how to make access control expressway, which is designed for two-wheeler also. I showed you the graph, and this is true for many other countries also. Increasing use of motorized two-wheeler or powered two-wheeler on rural roads, and the helmet use is extremely low in rural areas. Rural areas cannot have the same kind of police enforcement that is possible in urban areas. So, in that case, what is the solution? What new research is required here? And the last point, equally important, that we find a lot of times informal bus stops are coming up on high speed roads near entry exit ramps and near rural junctions. And these are also becoming our major uh, black spots where we are seeing a lot of deaths. So, just quick thing, many of you are aware of this, road safety history. There have been some really good papers giving us historical lessons how the road safety science has evolved from 1900 onwards to where we are today. And of course, most globally, it is accepted then how we have to, the last column here, that we are talking about the current vision, the current paradigm is talking about safe systems approach, vision zero, how we adapt road systems to road users, etc. And I just wanted to flag this, and this is actually what is important for researchers to understand in terms of asking appropriate research questions. Because if we are in the first column, we see if the understanding is that crashes are happening because of chance, then we are asking a different set of research questions. When we are thinking about that road crashes are because of road devils, then our research questions are trying to identify who these people are and try to educate and punish and have penalties. But there is enough evidence. These we have already moved to the last column, and I really want that researchers in low and middle income countries should get a really good understanding of what has been understood historically, because otherwise we still keep asking the research questions which globally have proven that they don't lead to any meaningful results. And I therefore just want to reiterate that new risky situations that we find, the emerging risk, the the research questions and the research has to be guided by these three very important safe systems approach or vision zero principles. And again, what is publicly available in various documents, in various good research coming from other countries, we really have to internalize these things and see that how we can actually start translating it into our new research. So, vision zero notion of allowing incidents to occur. Entire transport system must be designed to accommodate the individual who has the worst protection. And now, from our description, we know that in our case, the worst protection is to vulnerable road users in low and middle income countries. And then responsibility rests with the people who design the system. So, these three principles and the history of Vision Zero Safe Systems approach should become the guiding principle for our new research. And it is. We do find many research studies coming out which are based on this. And we know that road design, infrastructure, and traffic control can influence road traffic safety in many different ways. So, in pre crash situation, in crash avoidance, the way we design our roads, it can influence the driving behavior by adopting to appropriate speed. So if we are designing, I showed you examples of high-speed roads going through small towns and villages. Should we not be designing it differently when we expect that people are going to cross the road? So those are the kind of principles we have to use here. Also, the way we design our systems, it can encourage pedestrians and bicyclists to use the safe paths. So instead of everybody on sharing the carriageway with the high speed traffic, I think here this is where we would need to come up with research that what would encourage pedestrians and bicycles to use, what designs are required so that they are encouraged, so they adopt the safe paths and not mix with high speed traffic. And similarly, at the time of crash, the severity of injury can be reduced by many design elements. This is known globally, and those principles are valid everywhere. There, we don't have to do any new research, and we can very easily adopt that. Post crash, also designs have to do a lot. And in our many low and middle income countries, we find examples that, in fact, the way infrastructure has been designed, it is increasing the severity of the crash, the severity of injury, such as, wrong design of fences, median openings are not available, so it is, people are either doing wrong side driving, or it is becoming difficult for emergency vehicles to move. So these are some issues that can be flagged and then should be taken up. So what are the most urgent research questions for us? I think most urgent research question is this only. We look at our data. All our countries are expanding the highway system. So why highways in low and middle income countries have not become safer? So in India, we have found that upgradation of undivided highways into divided highways from 2 to 4 lanes to 6 lanes, this has increased number of deaths. So clearly, just adopting the known standards is not making it safer. Why many low and middle income countries continue to have 20 to 40% pedestrian fatalities on highways? And these are not urban areas. Whereas pedestrian fatalities form a very small proportion of fatalities in high income highways. And that is why we have to relook at the standards and designs. Traffic mix in urban and rural roads are also very different in low and middle income countries. And partly, I have shown it also, but all of us know that use of powered two-wheelers very high, presence of pedestrian is very high, etc. So keeping this in background, and now I would just share with you some results of this study. The details are given here. This was published, Campbell Systematic Review was published in 2024. The systematic review was done for all 5 pillars: road designs, vehicle, road users, institutions, post crash, etc. In today's presentation, I am only highlighting the issues that we found in road designs, infrastructure, and traffic controls. And in this particular one, we looked at these 5 aspects: road design and urban form, protective infrastructure, speed control measures, bicycle, powered two-wheeler, pedestrian paths and plazas, and traffic control and junctions. So the studies which were targeting this were picked up: work zones and toll booths, and parking policies. And then we looked at the outcomes. And the outcomes, we picked up those studies which did mention outcomes in terms of measuring fatal crashes, non-fatal crashes. And we also picked up studies which had measured change in speeds. Because as we know that change in speed has a very direct relationship with uh, fatality and severity. And further details that within road design and urban form, we had looked at these various categories: lane width, shoulder, median, road lighting, etc. In protective infrastructure, we looked at guardrails, crash cushions, road safety treatment, speed control measures, bicycle, power two-wheeler, and pedestrian. So here we also looked at all these aspects which are highlighted in red color. We looked at traffic control and junctions, so again, including impacts of marking signs, signalized, unsignalized junctions, as well as roundabouts. And then in work zone, also we looked at a large number of details. Okay, so here are the outcomes of this EGM. Majority of the studies we found were on road design, urban forms, speed control, and traffic control. And we found least number of studies on bicycles, powered two-wheeler, pedestrian paths, protective infrastructure, and parking. So, and then studies which reported fatal and non-fatal injuries are also shown in the graph. So this is now important because earlier we understood that powered two-wheeler and pedestrian and bicycle are these three are the most important victims for low and middle income countries. But in published good research studies, we do not find uh, enough studies addressing these issues. And then we looked at study design, and various study designs were looked at, such as before and after studies, case control studies, cross section studies, actual experiments done, and then multivariate models. And you can see here that majority of the studies are before and after studies. And repeatedly, it has been pointed out by many researchers, and I just quoted here Ezra Hauer, that a lot of before and after studies end up becoming also naive studies because there are many confounding factors. And one has to take care of that before and after has been done after enough time gap. There should be no other changes in traffic volume, in geometric conditions, etc. So a lot of controls are required, which is not easy to do in this field. Though we did take care of that in this particular EGM, we were trying our best to pick up mostly good quality studies, but still before and after remains an issue. And actually, case control studies, cross section studies are much more robust. But we find very, very few studies which have used this study design. So you can see in orange color in all different aspects that we were looking at, road design, bicycle, power two-wheeler, pedestrian paths also, majority, whatever few studies are, majority of them are before and after study. So the quality of studies, also robust studies are not easily available. Then in terms of, we looked at where these studies have been done, in which countries. And as expected, you can find here that, the light blue color is South Asia, and you find that very, very few studies for road design and urban form and speed control and infrastructure. All the others are almost nil. And then we find, and similarly from sub-Saharan Africa, you don't find any, I mean, the quality of study which we could include in our systematic review, this evidence gap map. Majority of the studies are coming from North America. And then, of course, there are yellow color is showing Europe and Central Asia. And then there are few studies from Middle East, etc. So studies in low income and LMICs are missing. Quality of research study is to be improved, only then we could. So all the studies, we see the good quality studies coming from North America, but are the results completely transferable? That remains an issue. And we find also, we looked at, major topics that these studies had done in terms of motorized vehicle and non-motorized. So we find that most studies have focused on motorized traffic because most studies did come from North America and Europe. And in the current focus on sustainable development goals, the non-motorized traffic active transport modes have acquired importance in both high income as well as low income countries. So these studies have started coming out now, but last 20 years, 25 years that we covered in this EGM, the studies dominating motorized traffic was much higher than others. And so the studies which were really important for low and middle income countries, bicycle paths, traffic controls mostly have been studied in urban environment. But in our case, we find that we have a lot of bicyclists, pedestrians in rural environment, in low and middle income countries, those are completely missing. So now just look at a couple of concerns where as far as transferability of results is concerned, because there were some good studies which one could use. Majority studies in high income countries, especially North America and Europe, the traffic mix is very different. Whereas we find in sub-Saharan Africa, Southeast Asia, presence of pedestrians and motorized two-wheeler in rural and urban areas, including our expressways, is there. So we have to really look at these aspects with fresh eyes. And of course, the quality of study remains an issue. Also, in absence of high quality systematic reviews, so that is also something that researchers should focus on. Couple of issues that I want to highlight which came, and for example, the studies which and the results which we got on shoulder width. So several studies have found a positive effect of increasing shoulder width on road safety. However, for some circumstances, injury and property damage only shoulder related crashes or multi-lane, significant negative estimates are also found. So here we are saying that transferability is questionable because majority of these studies have come from US, and there the traffic obviously is very different. We do not find presence of as many motorized two-wheelers and pedestrians on the highways. And so, in fact, the conditions existing in many of our countries, low and middle income, is this. Pedestrians are crossing, you can see, jumping over the fence on high-speed roads. There are parked vehicles on the shoulder. And then, of course, the highway is almost looking like an urban section. So here, if you're going to have an increased shoulder width, what does it imply is not clear at all. And then I always, highlight this when talking about this, that as pointed out by Rune Elvik in much earlier publication, that anything we do on the road has engineering effect as well as behavioral adaptation. So how we look at behavioral adaptation in our condition, because impact of shoulder widening actually results in high speed traffic. The motorized vehicles start going at a higher speed, but that is on the shoulders only we have presence of vulnerable road users. So this is an important issue which has to be understood in our context differently. And the second important question that we found, we also focused on, how about looking at the impact of raised median. And raised median, in fact, is this. We are having in many of our roads, almost high speed roads, 200 mm high median. And theoretically, I mean, there is a lot of literature already showing that why it is hazardous. And in fact, see, this is the kind of median we are having. We are measuring it here and showing, and this is an expressway. And we do find on our expressways a lot of rollover tire burst crashes. Now, when we try to do a systematic review of this issue, which was published in again 2022, we found that globally, after actually 72, we could not find any study because this thing has been rested. And AASHTO clearly recommends that vertical curves should never be used. But in our all over Southeast Asia, we are having this issue, and we find this is happening in Africa also. So, which standards are being followed? How the experts are recommending high speeds, and it is posing high risk to motorcyclists as well as all other vehicular traffic also. Again, this also has to be clearly understood and brought out. Impact of paved shoulders. Now, IRAP has done a lot of good work. They have collected a lot of interesting, globally robust results and come out with what should be done. But IRAP intervention, and again, this commentary is also published last year. IRAP interventions often focus on making roads smoother, wider, straighter, and therefore faster. And in many sections in India, paved shoulders have been provided. Now, paved shoulders are also going to result in behavioral adaptation, which means higher speeds. So, how it is going to have an impact on VRU has to be understood very carefully. So, if I just want to highlight two major research gaps, current knowledge of impact of infrastructure designs on road safety is limited to high income countries. We have good, robust studies, but the context in LMIC is different. So some of the results have to be revisited and researched here. Impact of shoulder designs, median type, service roads, shoulder markings with audible markers, they all have to be, we have to do this kind of work in Africa, Asia, and other low and middle income countries where the presence of vulnerable road users is very high. So let me take just few minutes to talk about way forward. First, of course, I showed you a lot of discrepancy in data. So we have to address that. What are some simple triangulation methods? Understanding theory and interdisciplinarity is extremely important. That guides our research questions. Power of observations, what we observe on our roads, and based on our understanding of theory, how we can ask relevant questions. And then comes the issue of robust study designs, of some known study designs which can easily be done. So Kavi Bhalla from University of Chicago has done, done again a lot of work in this area. And there are detailed examples giving work done in Argentina and other countries, India also, that if you're measuring burden of road injuries, of course, we have to do the estimate of incidents. How many die and how many get injured? And guiding philosophy should be best estimates of the incident should be generated by triangulating from all existing data after correcting for source-specific biases. What does it mean? So we have many sources of data. Police report is one, but then we have death registries. We have hospital admissions, we have emergency room visits, and we have home care. And each level is giving us different level of details and it has its own biases. So that has to be understood and combined to come up with more believable estimates. A recent study undertaken in India by one of my colleagues has shown that, so this was a hospital-based study, 5 major trauma centers in Delhi, and linkages with police data show that only 31% of all hospital admissions have a police report. So you can see the gaps coming out here already. Medical records are very good to identify injury patterns, and through that, one could identify head injuries were found to be more common among pillion riders as compared to drivers because in Delhi, riders are wearing helmets much more than the pillion rider, even though the law applies to both. And the largest trauma center in the city has only 30% of its patients being transferred by ambulance. So a lot of these kind of details come from looking at other data sources. And then our skill lies in how we combine these different data sources. So data or scientific method, whatever we use, has to be based on theoretical understanding. And what is that theoretical understanding? A fundamental understanding of theory. That is what will drive what data has to be collected and what method. For example, if the theoretical understanding is that driver error causes crashes, and driver training obviously can reduce traffic crashes, so then as a researcher, one collects different kinds of data. Then we end up focusing on driver-related data, education, training, etc., and knowledge about driving rules. And then we start showing, that how there are gaps and we running regression, etc. On the other hand, if the theoretical understanding is that driving behavior is influenced by the road and traffic characteristics, in that case, as a researcher, I will focus on road geometry, traffic characteristics, operating speeds, traffic volume, type of vehicles, and model this to control traffic crashes. And this is what historical table I showed you, that how historically researchers have moved away from focusing on individual errors. And we will revisit this picture and how we can ask now, what questions should we ask here? Is it that these pedestrians do not know the risk? They have to be told the risk of this high speed traffic. They have to be taught how to behave on the road. Or we look at, try and understand that is it not expected human behavior, because this is the shortest path to cross the road. So as a system designer, should we be looking at alternate design here? Or what are the land use patterns? Why are everybody is standing here and crossing the road? So a theoretical understanding will actually encourage us to ask different questions. Similarly here, there is a foot-over bridge. A lot of people are crossing the road at grade. So what is the research question here? Why are people crossing this? Is it about their education? Or is there some other understanding we need here? And that should lead to a different design of road crossing facility. Similarly, we find, why pedestrians, same questions that I raised earlier. All these have to be, and the question have to be asked that is it about awareness, or is it about enforcement, or is it a design question? Maybe a design question combined with enforcement, but what enforcement works here? So those are the kind of research that would give us. And I want to end this with this research paper that I read sometime back, 2022, and it says that actually safe systems approach also has to be understood correctly, even by many good researchers. And the moment we say that shared responsibility, in fact, it is inconsistent with safe system, because again, we are bringing the individual into the picture. And the last line here, set of action pillars are defined to guide safe systems approach rather than safe system approach principles guiding actions under each pillar. There is a difference between the two. So simply saying that we are looking at 5 pillars, that is safe systems, is not adequate. The action in those 5 pillars have to be guided by the principles of safe system, which starts with human makes error and human beings are fragile. So I think this also has to be interpreted and integrated in our new research questions. And the acceptance of human error and strong influence of road design and road user behavior as a factor actually pushes system designers to identify innovative solutions. And that is where we have to push our research in low and middle income countries. And it would also result in stronger regulation for vehicles and road standards, maybe different standards for our high speed roads. And enforcement is an interim measure. Ideally, it should be a self-enforcing system, which is still really far away. And this is where our research efforts are required, how to make that. So finally, safety science is about interdisciplinarity. So I encourage all researchers in low and middle income countries to work in multidisciplinary domains. It is an intersection of social science, engineering, economics, mathematics, etc. Problem orientation means really that developing consensus amongst different stakeholders. So it becomes important for researchers to work with administrators, infrastructure designers, as well as road users. And then system approach really means that, we work the subsystems that we have, road users, infrastructure, vehicle subsystems. We have to see how these three subsystems interact with each other, what are the emerging risks here, and then how we start addressing it in our research. So in the end, of course, you can do some nice Google search and find a lot of good studies, but I did want to highlight, especially for our researchers from low and middle income countries, look at some nice summaries of traffic safety research which has been already published. And I've just listed three here, but you could find many more. I find these three very useful. And similarly, some new research studies which have been published from these three studies are from India, but these are using case control experimental design. And case control study design actually takes care of a lot of data issues. So this is one of the useful study designs to be used. So once some researchers can look at it again. And again, it is not just restricting to this in the short presentation, just to highlight that some of these things are available. So yes, I can stop here. Thank you.
Thank you very much, Geetam. Really, really interesting to listen to you. We are out of time, but I think I will allow a couple of questions so that it will not be just an abrupt stop. The audience, please, if you have a question, write your name in the chat and I will call you out. And while we're waiting, a quick question to you, Geetam. What I kind of missed in your presentation is the aspect of implementation, because very often when you talk to researchers, like right now I'm physically in India, and when I talk to colleagues here, I mean, they know about safe system, they know about problems, they know about solution, but in many cases they say, well, this is not going to happen. Very practical example, we've been traveling on a highway with 110 120 speed limit, and every 2-3 kilometers there is an opening for U-turns, and you can see those huge slow trucks making U-turns. Of course it is a risk. So I was asking, like, why don't you build a roundabout? Why don't you forbid U-turns? Why don't you find solutions? Well, this is not possible. It will not be accepted. So why the knowledge that exists and exists here locally, why it is not implemented?
So I think we still find a lot of, that's why in the end I highlighted that the researchers, as researchers, we have to work with administrators and people getting, National Highway Authority, Public Works Department, engineers, traffic police. That interaction is very important, because simply saying that, okay, this is the best solution, do it. But if you listen to them, they have some other arguments. So one other thing is that coming together and building those coalitions, that let's try out this, and convincing them that by trying out, actually, because one uh, um, response we also get very often, oh, it can happen in other countries, it will not happen here. So then we have to kind of convince people, no, let's try to do some pilots, examples, some pilot experiments, and let us find ways of, So my sense has been that we have to continuously engage with our decision makers and public authorities. Otherwise, of course, there will always, this gap will remain. And what I remember actually discussing with Professor Ezra Howard, these gaps have existed in other countries also. But the way to solve it is keep talking, keep creating platforms where you can have this engagement, and both researchers as well as the public authorities start understanding. And towards the end, what I talk about, consensus building, developing a common vocabulary, I think only then this is going to happen.
Okay, great. And I see we have two questions. So Oliver, please.
Thank you very much for a really interesting talk, which covered a huge amount of ground. But I have a slightly similar question to Alexei. In some cases, we really don't need more research. We just need more action. You cited the example, for example, of the raised medians, and you cited American research that shows that increased risk. So we have the example of the gaps in the central reservation, which, by the way, we also have in the UK on 110-kilometre-an-hour roads. It's a real indictment of the current infrastructure and the people managing it. And then you gave the example of the footbridges. Well, we know that footbridges don't work in crowded spaces. So isn't one place to start with the design manuals and just forbid practices like raised medians, gaps in the central reservation, footbridges as a solution in urban areas? I mean, all those solutions or implementations are totally obvious. We don't need research to prove that people in South Asia will cross a road ignoring a footbridge. They'll do that in the UK too. Humans are the same everywhere.
So you're absolutely right. Actually, the median example, for a very long time, we kept showing ASHTO. Look at ASHTO. It says it should not be done. The vehicle goes into unpredictable trajectory, etc. But the whole logic, our expressway authorities kept saying, no, people will cross the road and some, people will jump across the median and this, that. Finally, we said, okay, let us do a review. And then we realized that there are no new studies which are going to look at this. So then we went back to the authorities and we said, if you still want to do it in Indian conditions, but this is what the global research is. We cannot have high medians. So finally, on that expressway, what they have done is they did not remove the high median. They have put a tri-beam, correctly, I must say, because the phase aligns the median has avoided, that is actually eliminated. This has to be now eventually the road standards that we have. So over bridge, I don't know any number it works. Highway authorities. So we are still struggling. How to convince this? The drone studies show that the risk has increased to pedestrians there because motorists expect and there are people running across the road. So that is a struggle we're still doing and thinking. But I completely agree with you. Some of these are global results. These are robust results, and we don't need any new studies, just new methods of convincing. One more question. Okay. Do you want me to pick up more questions or how do you want to do it?
Yeah, well, I will call out people. So next one is Shalom.
Okay. I think I visited the Geetam's Institute
Yes.
25 years ago and had a talk with you and with Dinesh.
Nicole.
And
Yes.
Nicole was there on a safety course. I want to go one step further, and I raised these questions also with Dinesh, but I didn't get much response or positive response. When you have 50 or 60% of your casualties pedestrians and cyclists and small motorcyclists, then obviously the Western road system is not adapted to that sort of mix of road users. and you have to think radically, think
Different.
about a radically different
Mm.
transportation system. For pedestrians to cross a 6-lane motorway is impossible.
Yeah, yeah.
It cannot be done. Oliver pointed out correctly that over and underpasses don't work, and pedestrian crossings on a 6-lane motorway are unpractical. So we have to go to a totally different system with much more reliance on public transport and perhaps on separate road infrastructure for the for the small vehicles, for pedestrians and the motorcycles and the bicycles and the tricycles. I think there is only one country that has experimented with that. It's either Thailand or Malaysia.
Malaysia. Yeah,
Malaysia.
yeah, yeah.
But I haven't seen it applied anywhere else. But obviously the current Western roadway system, and it seems that all low and middle income countries are following the same road. Of first going to more and more cars, building more and more roads, having more and more crashes, and then starting to think of having a different transportation system.
Yeah. Yeah, yeah. I think you're absolutely right. Actually, I have not shown any solutions here. But I think the appeal to researchers from low and middle income countries is to look at these issues differently. Because otherwise, they keep doing the same, and some problem that Alia Casey mentioned earlier, that we end up having a lot of studies which you find, that what is new, what is there to publish.
Yeah.
So that is why you're absolutely right that how we have to reimagine our system, and that reimagination comes from new research questions and coming up with new robust designs to answer those questions.
Okay, good. One more final question. Ashta, can you please speak up?
Hello, am I audible?
Yes.
Yes, yes.
Yes. Hi, ma'am. Thank you for the insightful session. My question was simply that, there's obviously need for coordination to take place across different actors in the ecosystem. But I wanted to know how can we ensure that it's meaningful? Because sometimes we do have these platforms, but it's difficult for it to result in the actions needed. Like people working on different aspects, different E's across the road safety ecosystem don't agree on the action that needs to be taken. So, yeah.
So I would suggest that at present, I mean, these are always very difficult issues. However, in the current, at these days, we have two governance structures that we can use. And you know that every state has a state level lead agency for road safety. And that is supposed to be a combination of all different departments, all stakeholders at state level. And the lead agencies are expected to work through district road safety committees, where the district magistrate is in charge. And again, road owning agency, traffic police, education department, everybody's health department, they're all coming together. So I would suggest that let us as researchers also start having a stronger interaction with state level lead agencies. And actually our understanding has been that they need a lot of help of experts in terms of analyzing data and then guiding what needs to be done, and similarly at district level. So I would suggest that those would be two governance structures that we should make use of, and also be ready that these are not. I mean, people won't get convinced very easily, but we have to keep that effort, and hopefully, when there is enough critical mass, we start seeing things. Actually, I would say that things are happening on the ground now, somewhat, because we do find many pilots of safe pedestrian crossings, new roundabout designs, doing management, a lot of traffic coming on rural roads. So things are moving, of course, not at the speed they should be, but I would suggest that use these two governance structures to move our agenda, to create consensus.
It's nice to know that things are moving in that direction. And definitely thank you for the answer.
Okay, I think we will round up now. So thank you very much, Geetam, for your very interesting, very insightful talk. Thank you very much, the audience, for your question. And I see there is quite a nice discussion going on in the chat, actually. So yes, I'm really pleased that we can generate this type of knowledge exchange. And I hope also that many authors from low and middle income countries will actually find your lessons, Geetam, insightful, and that will help to improve the papers that eventually will be published.
Yes, thank you.
Yes. This is the end of this webinar. There will be recording available. Just please give me 1 day to prepare everything uploaded, but it will be published on the journal's YouTube channel and also on our website. And please look out, we still have 1 or maybe 2 webinars left in this series, so there will be new announcements coming. So once again, thank you very much, Geetam. Thank you very much, everyone, and see you soon again.
Thank you. Thank you. Bye-bye.
Bye.